I remember my mother being frustrated with my grandfather for getting the van scratched on the right side shortly after she had it repainted. She thought that my grandfather just needed glasses. To our surprise, my grandfather was legally blind and had been driving around that way without knowing. Good evening, everyone. My name is Rosemary Lee, and before I urge you to get regular examinations, I'm going to be discussing with you what to expect from regular examinations, the benefits of regular examinations, and how frequently you should get your eyes examined. Now, let's discuss what to expect during an eye exam. There are going to be some things going to be checked, like your visual acuity, to determine if you need any vision therapy. In other words, your vision is going to be checked to see if you need glasses or an update in your glasses prescription. Then other tests are going to be done. Preliminary tests are going to be done, like checking the movement of your eye muscles, checking your color perception, checking your peripheral vision, the reaction of your pupils, and the pressure in the intraocular pressure of your eyes. After that, your eyes will be dilated. When your eyes are dilated, we use drops to force your pupils to open. That way the doctor can look inside your eye and check your retinas. When your eyes are dilated, you're going to notice that you're going to be blurry for a few hours. After your eyes are dilated, you're going to be checked under a microscope, which is called a slit lamp. But what does all this mean? The preliminary tests and the tests that doctors do they can check for ocular findings and even health indications. For example, preliminary tests like color perception test determines if you're colorblind. The peripheral vision test can determine if you're having a loss in your vision out on the periphery, which can be an indication of glaucoma. When they check the muscles of your eyes, it can determine if you're having muscle weakness or other serious things like a stroke or uncontrolled diabetes. The pupillary reaction can determine if you're having any neurological disorders. When the doctor checks you under the slit lamp, under the microscope, he can determine things like, do you have dry eye syndrome? Do you have any allergy problems? Do you have any infections? And they can check for cataracts and glaucoma. Now, what is glaucoma? Glaucoma is a silent disease of the eye in which your pressure continuously rises until eventually you have nerve fibers that die. And when the nerve fiber dies, you end up having loss in your peripheral vision first. It's called a silent disease because it's usually asymptomatic. You don't have any indication you have it until your peripheral vision is lost and you eventually have tunnel vision. Now, going back to your exam, when your eyes are dilated and the doctor checks in your retinas, he can see things like any indication of high blood pressure, high cholesterol, diabetes, stroke, and even cancer. It's amazing, right? But now, how frequently should you get your eyes examined? The American Optometric Association recommends that your first exam be at 6 months of age. Thereafter, age 3, and then before first grade should be your next examination, and every 2 years after. Now, if you're an adult in the age between 18 to 60, you should get your eyes examined regularly every 2 years. After the age of 61, your examination should be annually, but again, unless you've been recommended otherwise. Now, keep in mind that I want you to be in tune with your vision and listen to your body. If you notice any type of changes in your vision or any vision loss, get your eyes checked immediately. There are treatments and surgeries that can be done to help improve your vision before it's too late, because vision loss can be irreversible and permanent. The Academy of Ophthalmology reports that about 3.6 million Americans are visually impaired, and then about 1 million of Americans are legally blind. Yet the medical service concludes that only about 60% of Americans get their eyes examined regularly. So, in closing, I urge you to get regular examinations. A few hours, a few times a year could save you or your loved ones from losing your vision like my grandfather did. My grandfather suffered from advanced glaucoma, in which he had no idea until it was too late and he lost his vision and eventually his independence. So I urge you, get your eyes checked annually or regularly so this won't be you.